The date is May 20th, 2009. Today we have a special interview on the very scary and deadly disease. You will find out your chances of getting this disease when we get back from this commercial break.
That's right, Kyle. Huntington's disease expert Ben Solomon will now go into extensive detail on this disease.
How is the genetic disease, Huntington's disease, inherited, and what are the chances of passing the disease on to your children?
There's a 50% chance of passing the disease on to your children, and the disease does not skip a generation. So if you have a kid that doesn't have the disease and mates with someone else that doesn't have the disease, and they have children that all don't have the disease will not come back. So it will be gone from that family forever.
Okay.
And ever.
Okay. How common is Huntington's disease?
There's an approximation that about 7 out of 100,000 people get the disease, but that varies among races, so some races may have more than others.
What does a pedigree of Huntington's disease look like?
A pedigree of Huntington's disease looks like, well, it's probably on your screen right now.
An unaffected female mates with an affected male, who is a heterozygous. With HD, you can't be a carrier. You either have it or not. The affected male and the unaffected female have 4 children, 2 affected and 2 unaffected, which shows that there's a 50% chance of passing the disease on to your children. One of the unaffected children mates with an unaffected female, having all unaffected babies. The disease will not come back to this family because it doesn't skip a generation. HD is autosomal dominant because it can't skip a generation and because you can't be a carrier.
When do symptoms start?
Symptoms usually begin, well, in the beginning they're usually unnoticeable, and they usually begin between the ages, like you usually get affected by the disease and you see the symptoms between the ages of 35 and 40, but with juvenile Huntington's disease or juvenile HD, the symptoms begin to show before the age of 20, so you can tell that there's a big difference there.
What organs does the disease affect?
The disease affects and actually takes place in the brain. So it happens to the nerve cells in the brain.
What actually happens in the brain?
So what it is in the brain there are nerve cells with what have Huntington protein in it, and the proteins help the nerve cell do its normal functions. And a normal Huntington protein has somewhere between 10 and 35 glutamine, which is also known as CAG, the letters on the DNA. But when you have an affected Huntington protein, it has 40 or more CAG or glutamine. So, and then with the formation of protein aggregates and neuronal inclusions, it affects those things interfere with cellular proteins and systems, which later cause the cell to undergo apoptosis, which you guys know is, say it with me, programmed cell death. Yeah.
Explain the symptoms and how they get worse as the disease progresses.
Okay, so the main symptoms are mood changes, so you don't act how you used to. So if you were always like a kind grandmother, let's say for an example, you were a kind grandmother, always loving to your grandchildren, then sometimes you'll not be so nice to them, but it's the disease that does that, obviously. And then you also have uncontrollable movement, so you'll move sometimes and you can't control it, or twitches, thoughts of depression, yeah. And so those are the basic things. And in the beginning of the disease, when the symptoms first start, the symptoms are very unnoticeable, and as the disease progresses, these things become a lot worse. So things like movements, you have a lot more movements, and you can't concentrate, and more thoughts of depression, and you begin to slur your words, so you can't really talk so well.
Does Huntington's disease affect any daily activities?
Yes, it can. For example, let's say you are a dancer, and as I said before, you can't have uncontrollable movements. So let's say you wanted to be a dancer, and you've been a dancer for your whole life, and you're a very talented dancer. You might not be able to do that because movement problems, so it might be hard to do stuff like that. And also things like driving, that would probably be tough to do.
Are there any medications that you can take?
There are no medications meant specifically for Huntington's disease, but because some of the symptoms are thoughts of depression and uncontrollable movements, you can actually use regular medications that people would use. Like, let's say you're depressed, you can use antidepressant drugs, so they would use something like that, or some drugs that help you uncontrollable movements. Some drugs, normal drugs, but not specifically enough for that. And also nutrition, if you eat, if you take care of what you eat, that could also help the disease.
Okay. And once you start showing the symptoms, what is the usual lifespan?
The usual lifespan after the symptoms begin to show is usually from 10 to 30 years. So it's cutting your life short. So let's say you're 40 years old when you get the symptoms, you probably won't live more than 70, and that's at the best. So.
Okay, and finally, are scientists looking for a cure?
Yes, they're looking for a cure, and it is expected within the next 10 years that they will have a cure. They don't know, though, but they're trying. Okay. So give some money to charities for Huntington.
Thank you. It was a
disease.
pleasure meeting with you. I hope you find a cure.
In the English alphabet, an example of an amino acid would be the letters HAT, which, as we know, code for the word hat. In Huntington protein, however, we know that the letters CAG code for glutamine. To explore Huntington's disease a little bit more, we'll have to go into the brain. So let's keep digging. Here comes the nucleus. Let's go inside. In the nucleus, we'll find some chromosomes. Here they are. Inside the chromosomes, as we know, are DNA. So let's go check them out. Here's a DNA. On this DNA, we'll find the letter CAG over and over, the letters that code for glutamine. On a normal person, you will find CAG somewhere between 10 and 35 times. On someone who is affected, you will find 40 or more copies of CAG. From 35 to 40, you're not sure. You can be affected or not. If there are too many copies of CAG in the protein that's going to be made, there will be too many copies of glutamine. This is what an abnormal Huntington protein looks like, and this is what a normal Huntington protein looks like. The normal Huntington protein is able to function normally in the nerve cell. However, the abnormal Huntington protein stacks up with other abnormal Huntington proteins to form something called an aggregation. Other normal proteins who are doing their normal function are attracted to this aggregation, which stops them from doing their normal function. With this aggregation, other parts of the nerve cell begin to lose their function and their ability to work, and the cell, in the end, undergoes apoptosis. Programmed cell death. As more of the nerve cells undergo apoptosis, the brain begins to slowly not be able to do its functions that it used to do, which leads to the symptoms that you learned about before.
Good interview. Back to you, Kyle.
What a great interview. I sure learned a lot. Have a great night.
You learned a lot about hunting.